My name is Julia, and I'm going to provide all of the education that you asked for about the breast cancer screening. So the United States Preventative Task Force recommends that specific individuals choose if they would like to be screened or not. And the American Cancer Society recommends screening for moderate to low risk patients starting at the age of 45. So the American Cancer Society says 45, and then the United States Preventative Task Force says 50. But you can make the decision to do it on your own between 40 and 49. So essentially, the U.S. Preventative Task Force grades each age range based off of the net benefit. And so the age range of 40 to 49 is a Class C recommendation, which essentially means that performing this screening is based off of my professional judgment or your preference. And there is a benefit to doing the breast cancer screening early, and that benefit includes reducing the risk of cancer death. But on the same token, there's also risks associated with doing early breast cancer screening. Those risks include overdiagnosing breast cancer, overtreatment, and unnecessary additional imaging, and biopsies, which could be costly, which could be costly to you. And so the reason why they make these grades is because they find the net benefit, which means that they're trying to find how beneficial it is to perform these screenings. And they find this net benefit by performing observational studies. And these observational studies that have been performed on this age range of 40 to 49 have not shown very sufficient evidence that there is actually a benefit overall to performing them. There's a limited number of size of the studies, so not very many people are volunteering in these studies. They don't have very much information. And then oftentimes with these studies that they've found, there's flaws in the study design or the method in which they're performing the study. And then each individual study that's been performed, they've all been inconsistent, which basically means that they've all found different findings. They're not all the same. And why they base things off of consistency is because with studies, in order for it to be proven to be factual or to be something that is evidence-based, it needs to be able to be replicated by other people. So then there's also not enough information on important health outcomes at all. So the U.S. Preventative Task Force has said there's a very small benefit. The benefit that it does have is very small. It doesn't actually reduce breast cancer death in every woman. It can prevent about 3 cancer deaths in every 20 women. Out of 20 women, it can prevent 3. But with each age range, the grades increase, and so that means that they're finding more and more benefit as your age increases. And that makes sense because as your age increases, the risk of getting breast cancer increases also. So as of right now, I would recommend that we just continue to do self-breast examinations at home. If you have any questions or concerns, always call and come to the clinic, because the concern with performing a mammogram right now is that they might see something on the mammogram. So when they do a mammogram, they're looking for abnormalities in the breast. And if they see that abnormality, that may not be cancerous. It may just be a benign abnormality. But this can result in diagnosis of cancer based off of a first image. it could lead to unnecessary additional imaging. It could lead to unnecessary biopsies. And as of right now, you have no risk factors, no signs based off of your breast exam that indicate we need to do a mammogram at this time. If you would like to do a mammogram to be on the safe side, that is more than okay. Yeah, that's an awesome question. You want to learn more about how to prevent breast cancer. Of course. So essentially, some of the options that are scientifically proven are limiting your alcohol intake, just making sure that you're not drinking in excessive amounts, because they've found a correlation between the two. And then also, you don't smoke, but continuing not to do so is very important in preventing breast cancer. And then additionally, making sure that you're exercising, maintaining a healthy weight, and maintaining healthy eating habits so that you do not develop risk factors. So those are the risk factors that you can control right now. And then but there are risk factors that you're not going to be able to control, and that would be increasing age. And so that's why we're going to encourage you to continue to do self-breast examinations and coming to the clinic if you have any concerns. Yeah, so you would like to proceed with just self-breast examination monitoring, and then making sure that you're alleviating any risk factors by performing breast cancer prevention. Okay, that sounds like an amazing plan. Yes. Do you have any questions for me at this time? No? No questions? Okay, thank you.